with you today and to present to you today. I'm from Brooklyn, Jamaican born and raised, but I went to high school in Bay Ridge and then went to college upstate New York. So um, Brooklyn is close at heart. So, I'm not a stranger in that way. So today I wanted to take you through, and there's three topics to talk to today. The first one we'll cover is on health information infrastructure and interoperability. And the key here for me and what I want to impart to you is about the importance of the technology, health information, especially as it relates to interoperability. It's a challenge that's faced now, and it has an impact to patient care. And so we'll talk a little bit about that. In the three areas, the health information infrastructure and interoperability, the telehealth, which is the second topic, and then the patient monitoring systems, I wanted to kind of take us out of the textbooks, okay? You can read the textbooks on your own, but I wanted to share some of my personal passion and also information and experience. So I hope that's okay with you all. Also, as I go through the slides, I want it to be interactive. I know we've got a couple hours, so we just have to be cognizant of that too. But I do want your input. So if you have a question, feel free to ask that question, okay? If you need clarity on anything, please feel free to pause me and ask, okay? All righty, let's go. So the learning objectives, again, defining the health information infrastructure. What is that, right? Understanding the vision and benefits of the health information infrastructure, and of course the history. That's some of the stuff you can get in your textbooks, and I'll cover that just to make sure we lay a foundation. But I also have taken the liberty, like I said, and really bring into the discussion care coordination, because at the end of the day, the technology is about enabling better patient care and quality care. All right? The why do we have technology? It's for that enablement. And so I'm going to talk about that interoperability and the impact, or the gap in interoperability actually, and the impact on patient care. And then we'll talk a little bit about the future. What does it look like next gen? And the reason I share that in all the presentations that I do is because, especially to people coming into the industry, or even if you're currently working in the industry, is how can we strategically think about how to position ourselves? And I come from a business mindset, okay? So where can you identify opportunities for yourselves, okay? And your business, as an example, in the technology world, in the care delivery world. That's the why that you're doing everything for patient care and patient care delivery. So in terms of what's the HII? As this states here, it's a community level information system designed to make comprehensive, and that's a key word for you, okay? Comprehensive electronic patient records available when, where, right? And also the timing. So when and where and timing, and to the right persons. That's important. But it's about the population health, the population, the patients, the community. And you're living in a COVID-19 world. You see how it's important to have appropriate population health. And here's a gap that you may have seen, experience right now. Technology does not support the care needed comprehensively in a COVID-19 world to support the population health. Perfect example. Also, the health information infrastructure, as it says here, promotes healthcare standardization. One of the challenges that we do have in terms of ensuring interoperability is a gap in standards also, right? And when you talk about interoperability, meaning one system being able to talk to another system, because sometimes vendors have some different standards in your technology, it kind of inhibits that exchange. So there's standards that are established. For example, HL7 standards, right? A standard where the interfaces can communicate data. So there's standards that are required to support the technology. And again, with the purpose of developing an interoperable healthcare technology system. So according to the text, the vision for the HII is the availability, again, made available for care delivery to the population, right? But it needs to be a comprehensive and of course, electronic information system to the right person at the right time with the right information. And the purpose of that is to make accurate clinical decisions. At the end of the day, that's what it's all about. So the why, I always want to know why am I doing what I'm doing? What's the why for my work? What's the why for my presence? What's the why for anything that we do? And I will try to attempt to share that with you. Question, when you look at this slide, I want to get your impression of it. Can someone share with me initially, just looking at the slide based on your knowledge, how would you interpret this slide?
Complex.
Exactly.
Like all of the facilities or all of those places seem to focus on the patient or Jane, or yeah.
Mm-hmm.
It's patient-centered.
Patient-centered, excellent.
They're
They
different.
seem to be interconnected.
Yes.
They're like different professions working together.
Yes. Anything else? All right.
Comprehensive. Oh, sorry.
No, go ahead. Go ahead.
Oh, I guess it's comprehensive.
Mm-hmm. All excellent answers. Okay. So here's an example, and it's a mental health use case. It's actually a slide I used when I did my dissertation, and I just continually share this because I think it gives a perfect example of what a patient care ecosystem could look like. In this case, it's a mental health patient, right? John and Jane Doe may be a mental health patient. They could also be a patient that may have diabetes, okay? But the whole point of this, as someone said, it's patient-centric, okay? Number two, there are several different caregivers in that patient ecosystem, right? Who need to communicate. Each of those arrows is some level of data being exchanged within that ecosystem. It is very complex, as was stated, and it's comprehensive too. But here's the whole picture of why the health information system needs to be interoperable, okay, to ensure that exchange of data by certain data standards, that everyone shares that data standard to deliver care to those patients at the right place, at the right time, with the accurate information. The whole purpose is right here. This is where we also fail as a system. Because, as a perfect example, in this ecosystem here where the arrows are, in our real world scenario, those arrows are all broken. So there's a gap and a delay in patient care. There's a gap and a delay in care coordination. And there's a potential negative impact to the patient and also to the providers. So we talk about the Quadruple Aim and also the United Nations Sustainable Development Goals. You'll see the acronym SDG. Who's heard of the Quadruple Aim and or the United Nations Sustainable Development Goals? All right. So here's where I bring a little bit of my outside experience in. And again, the why. Why are you doing what you're doing? Why are you studying what you're studying? Why are you even in school? Okay. So in the healthcare world, there's a framework called the Quadruple Aim that care delivery and providers of provisioners of healthcare delivery attempt to accomplish. Number one, for the Quadruple Aim, there are 4 quadrants to it, okay? Improving the population health, okay? The technology needs to assist and enable and elevate us to do that. 2, enhancing the experience of the individual, the patient, that patient-centric, someone said that. Reducing costs. Healthcare right now is really expensive, as you know, okay? What we do and how we do it and how we leverage technology needs to be able to reduce the healthcare costs. And again, from a provider standpoint, providers are burnt out even with using the electronic healthcare record. There are studies done that since the inception and the implementation and rollout of the EHRs, it has had some negative impact on the providers because they spend more time documenting. They're burnt out. So when we design technology, when we think about the work that we leverage the HII to do, we need to take into consideration quality, care, the level of care, the patient centricness of everything, and the provider. Now, the United Nations Sustainable Development Goal, why do I even bring that up? So as leaders, and I consider each of you here in its class as a leader, you'll be a leader at some point in the healthcare and in technology. You have to think not only locally, but globally, right? And when we do work and when we implement technology, it needs to have a positive impact. And so even globally, the United Nations, right, in order to improve the health and welfare globally, okay, they developed these 17 goals which will help to transform the world. And the question I have is, how can technology better enable that? And I tell you, COVID-19 is changing the way people think about how to use technology. So there are 17 goals, and one of those goals is, of course, healthcare, good health and well-being. Okay, and as you see here, I've taken this quote for Dr. Tedros Adhanom, probably mispronounced his name. He's Director General for the World Health Organization. He recognizes that and stated in his letter that improving and strengthening information systems is necessary. And the reason being is that there's a gap in data, right? There's a gap in data, there's a gap in interoperability throughout the world, okay? So from a healthcare standpoint, to achieve the 3rd goal here, healthcare IT, in my opinion, which I think is supported by this statement, is critical to success. So here's just a diagram I drew just to kind of put a picture about, you know, the quadruple aim and how that supports the sustainable development goals, specifically in our case for healthcare. To improve the population, to improve the health in other countries. If we focused on these things and also these quadrants, okay, and also figure out how to use technology to do it, we can make a change and transform the health of people. What are your thoughts around that? Do you agree or disagree, and why? Don't be shy. There are no wrong answers.
Yeah, I mean, I would agree with these. I mean, the quadruple aim, because being able to improve how we are able to, I guess, like to enhance patient experience, and being able to make it easier for us for like the providers to work for the patient. And I guess the rest of the aim, the pretty much good points to have like technically better life, I guess.
I also think you made a good point with improving the work life for the providers. I haven't really thought about that. I've dealt with providers before, even during the pandemic, and sometimes they would be rude, but like they were also dealing with like the pandemic and everybody giving them a call as well. So there's got to be some sort of standard for the providers as well to make their jobs easier. So I think you brought up a good point.
Excellent. All right. Thank you. I just shared a little bit more about the SDG. Within the SDG, within the healthcare segment, there are several targets that are laid out. And one of the area of focus, again, and I highlighted it here, and I spoke about this last week. I was speaking to the Caribbean diaspora on, via Zoom like this, but, focusing on mental health, right, and well-being. I personally think that the next pandemic that we may have globally is going to be mental health. We're already having issues with that, right? But it's going to get worse because of the strain that people are under. So I highlight this again. The World Health Organization is part of their goals and targets from an SDG standpoint. And also, if you think about the use case example, I showed that picture, that ecosystem is around the mental health, and it's different whether it be US or not, right? The healthcare system is different, but the whole idea is that you need all these services, and there's a need to have technology available, readily available to provide those services. I think the challenge, and this is something you may want to think about too, throughout your education and as even in your work environment, and if you have an international mindset, is that what works in the US may not work somewhere else, right? Because of infrastructure challenges. So then how can we devise a different health information infrastructure that would support a developing nation who may not have the infrastructure to support a system like Cerner or Epic from an electronic healthcare record system, but they have a cell phone. Just about everybody, when I go to Africa, everybody got a cell phone. I don't care what economic level you are. They've got a cell phone, okay? How can you leverage that with some more nimble technology, okay? So again, part of the problem in achieving those sustainable development goals is that the lack of interoperability. The healthcare systems don't talk to each other. There's some standards and also policy issues that we need to address, okay? And that's really crucial. For example, does HIPAA, the Healthcare Information Portability Act, I think I'm missing one P, but I can't remember right now. Is that appropriate in our current world, our current technology and healthcare information infrastructure that we're going to in the fourth and fifth generation of the Industrial Revolution? I'll talk a little bit about that too, right? So that lack of interoperability, the challenges that it has an impact on patient care coordination and the gaps in data. that whole definition of your health information infrastructure is all about this picture right here. The why. Why are we doing what we're doing? So interoperability challenges, right? So being able to, again, to connect technologies and data together. Okay, a quality healthcare system is one where data flows seamlessly across devices and location. There are breaks in that right now, holistically and nationally and internationally. Okay, providing better care across the continuum, the patient continuum of care, from admit to discharge. Okay, to be able to better care, provide better care and communication between the caregivers, okay? So they can exchange information and not have issues or missing data about a patient, which may cause what we call a sentinel event or patient safety event for a patient. And again, empowering the healthcare provider, again, as I mentioned, access the right data in the right place at the right time and by the right person. So that interoperability challenge is costly, right? So about 200 billion with a B is wasted because of lack of interoperability. Is that a contributor to the cost of our healthcare system? Possibly so, okay? Approximately 46% of the US clinicians do not have a complete view of their patient's health history and records. And currently with the centralized IT systems, there's silos, right? And increased errors. When you go outside of the hospital network, now, if I am in the New York City Health and Hospitals network of hospitals, right? They have Epic. There may not be that gap because Epic is deployed to all 11 hospitals, I think they are, and their long-term care and their therapy. I can't remember what they call them now. But anyway, but within that healthcare system, yeah, there's great communication. But take the patient out of New York City Health and Hospital and take them to, let's say, Mama D's, okay? There's already a gap there, siloed between systems. You can look at your own healthcare experience and think about if you have to go from one provider to the next, how are they exchanging records right now? Whether it may be by fax, you may have to take a CD or even a paper chart. So it goes back to, again, that care coordination challenge, right? The whole purpose for the infrastructure and the technology. That's what it's all about, okay? To better enable comprehensive care management, the care coordination, as I mentioned about, to be able to effectively manage patient transition of care, okay? And just from a community standpoint, you know, I don't know if you have experience within the mental health space, but if you think about from a community level mental health, to go from, let's say, for example, from a community behavioral health to housing to crisis, they're not talking to each other in 99.9% of the cases. There's a problem there, okay? So again, that IT, the interoperability is all about that care coordination. So there's some benefits, as you know, we've talked about, and I don't mean to beat a dead horse with a stick. Going back to having that IT-enabled healthcare system, is around the quality, the reduction in errors, emergency preparedness. And it goes back even to understanding the healthcare supply chain. Where's the breakdown that happens within that? And again, your COVID-19 experience with respirators, masks, all of that demonstrates why it would have been awesome to have an integrated system already. Okay. So requirements of a health IT infrastructure: privacy, stakeholder cooperation, the electronic exchange of information, the financial sustainability, the community focus, and the governance and organizational issues, okay? To be established is important to have a system, a workable, appropriate system. So the architecture can be both institution-centric, and of course, I think a couple of slides over the patient-centric, right? So from an institutional standpoint, what are the challenges? I've listed it here, but I'd like someone to kind of talk about it based on what you read in your chapter.
One of the challenges that was listed was that it takes a long time to import all of the, import the data, the specific data that the physician might want.
Good. Okay. Anyone else?
Sometimes it's the manpower and sort of loading all this information into the system.
Mm-hmm. Yep. Yep. And one of the things I thought, the second bullet here, it's not easily scalable, right? When you have the institutional infrastructure, sometimes it's not scalable. And the requirement to have that high availability, right? Having that 24/7 uptime can also be a challenge. And from the patient-centric standpoint, the patient controls, again, and ensures the privacy and security. And one of the technologies I'll talk about that is, I'll call it fourth generation technology, and it's blockchain, really can help support this even further, this patient control, right? Having that patient having that control over it. And also scalability too, okay? So this table was from your text, all right? So there's a comparison between the institutional centric and the patient centric. One of the things I think is interesting is that with the transformation that's happening with the new technology, innovative technology, the business model is changing, right? The way care is provided is changing. What do you think about that?
I think especially with us going through this pandemic, there's been a big shift towards like telehealth, telemedicine, in providing care.
Mm-hmm. Excellent. Excellent. And I find it interesting that how easily some regulations were relaxed, right? Yeah. And any other time there would have been resistance and friction. Just goes to show that we can do it if we want to. So some of the implementation challenges that are called out in your text is a lack of medical standardization. We kind of talked about that, and unclear roadmap. And I will say that organizations like the ONC and CMS, Centers for Medicare, Medicare Services, and the Office of the National Coordinators, they're laying out a roadmap. I don't know if I would say it's unclear. I think the vision is there. But you know, again, not really having a clear vision obviously can be a challenge for implementation, okay? The stakeholders' competitive advantage. Can someone talk about what is really meant in this context? The stakeholders' competitive advantage as a implementation challenge.
Is it how doctors are pretty much like, it's like they're competing against each other for like their patients pretty much, right?
Yeah, that's one aspect of it. Mm-hmm.
Okay.
And then even the vendors, right?
Vendors, you meaning what?
For example, a software vendor like
Oh,
Epic.
yeah. Absolutely, yes.
Mm-hmm. Mm-hmm. Absolutely. Privacy and security and confidentiality, when you think about healthcare records, is always key on the mind, right? Protecting your patient data, especially for mental health. You know, there are some larger constraints and laws and regulations around what can be shared and what cannot be shared. But there's a rule that was just approved through, I think, through Congress, the information blocking rules, which is helping to reduce that level of friction from sharing of data between providers and stakeholders. Okay. Our healthcare laws, in my opinion, really need to be revamped to better serve our 21st century and the fourth and fifth industrial revolution that we're going through right now. So if any of you have an interest in law, great opportunity for you to get involved. Bring your IT background with you, your healthcare background and law, opportunity galore. So a little bit about the history, I just condensed this, right? So in 1991, the recognition and the recommendation came that, hey, we need to go from paper to electronic. This is crazy, right? Carrying around these stacks and stacks of paper of a patient record. We need to digitize those records. And then in 1999, the Institute of Medicine studies showed that, again, error rates between 44,000 and 98,000 preventable deaths in hospital were happening because of a paper-based system. In 2004, the Office of National Coordinator was established to promote the standards and certifications of the electronic medical record system. So just about every EHR right now is an ONC certified. And if I was purchasing, let's say I was a CTO, a CIO in a healthcare organization, and was considering purchasing an EHR and it wasn't certified, I probably would not invest in that, okay? In 2008, for the HITECH Act and ARA and meaningful use, providers, certified, qualified providers, I'll use that term, had to submit data showing that they were using the system in a meaningful way. They were using the EHR in a meaningful way. What was interesting is that behavioral health and some behavioral health providers were not accounted for under the HITECH Act, which I think was a big mistake, okay? Again, fighting that, recognizing that a person's mental state is just as important as your physical state, okay? So my question is, where are we today and what potentially is our future? So I want to talk a little bit about, just kind of quick introduction, the fourth and fifth industrial revolution and the role of emerging technology in the health information infrastructure, okay? Have you read about or have any exposure to what the fourth and fifth industrial revolution is? If so, share your thoughts with me. All right. So the role of emerging information technology, and this is where the fun stuff really happens, in my opinion, okay? So part of what we need to do as innovators and thought leaders and IT people is to figure out how are we going to overcome some of those barriers I talked about, right? And part of the biggest barrier is, again, the interoperability, but also the data collection, right? And so how do we overcome using emerging technology, innovative technology in a healthcare information infrastructure, help to overcome those barriers, and again, to support and enable the quadruple aim, as we talked about, as well as the sustainable development goals, as an example, the why of the technology, right? The why for, I should say, the technology. So potentially leveraging blockchain technology and the distributed apps, okay, would help to make things a little bit more nimble. As I mentioned earlier, you know, in just about globally, just about everybody has a cell phone, okay? If they're over, let me see, my granddaughter is 3.5, she's gonna be 4 in April. And from she was 6 months old, she knew how to swipe. It's like she was born with a cell phone in her hand, which is really scary. So the technology is nimble, it's small, it's mobile. Our healthcare infrastructure needs to be able to support that, okay? And so again, in order to get the output, which is more data, because we're collecting data everywhere we turn. Our smartphones, that data, our smartwatches has data. The elliptical machine that I ride at, the Y, is putting out data. I mean, it's overwhelming, okay? But how do we get it out of silos, collect it, be able to analyze it, again, for the purpose of the population health? So the role of emerging information technology, again, overcoming the data collection, overcoming the interoperability gaps, right? Go ahead. Okay, sorry. And then decentralization is a term that you're hearing now, right? If you're exposed and working in this field, right? Currently, most things are centralized, one central repository, one central database. Now, the transformation is decentralizing technology and data collection and the whole healthcare infrastructure decentralization, okay? Being web-based, real-time information sharing, that's a gap right now in some instances in our healthcare infrastructure, right? Getting data real-time, okay? More collaboration between the providers within that ecosystem we talked about, and empowering patients to manage their health data. We need to strengthen our information system in order to close the interoperability gap. So what are DApps, or decentralized applications? Who've heard that term before? Okay, so they're web-based apps, and it's run on blockchain technology. Have you heard of blockchain before? And if so, in what context?
Mostly cryptocurrency.
Yeah, Bitcoin.
Exactly. That is the first thing that comes to people's minds when you talk about blockchain, and you are correct. So, you know, Bitcoin cryptocurrency runs on blockchain, but it also, blockchain has some really, 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 really excellent functions, and I think is going to be the foundational for AI, machine learning, you know, future state technology. So the decentralized applications, again, run on blockchain technology, okay? So here's an example. I love this pictogram here. You know, again, it shows you sharing of data, the public health application of it, right? Patient health data, again, putting the data in patients' hands. contract management, you talk here word smart contracts, okay? And it's secure and on demand. So all of the things that healthcare needs to ensure privacy and security from a healthcare infrastructure, decentralized applications and blockchain technology can help support that. Okay, so what is blockchain? So it's basically a database, but it's decentralized. Okay, and there's some features and functions of it. And by the way, blockchain is one example of distributed ledger technology. Okay, and the picture on the left gives examples of two other types of distributed ledger technology. So blockchain is one example of that. So there are 4 building blocks basically and functions that I think support of the blockchain technology that really supports the decentralization in what's necessary within our healthcare IT infrastructure that can better enable and elevate that care delivery and that care coordination and to bridge that interoperability gap, okay? So again, blockchain is shared ledger, shared database, it's distributed. The privacy and the security of it is a huge bonus, okay? So blockchain can either be public or private. Bitcoin, as an example from the cryptocurrency standpoint, is on a public blockchain, and that means it's permissionless, okay? You don't have to have permissions to access it. From a private standpoint, an example like Hyperledger Fabric, okay, is an example of a private blockchain where you have to have permission to access it. So from a healthcare standpoint, we would require and need a permissioned blockchain infrastructure, okay? Smart contracts is an aspect of a function and feature of the whole blockchain where codes are written that can automatically execute transactions, okay? And then a huge plus for the technology is the aspect of trust, okay? The big hesitation in sharing healthcare data a lot of times, especially again, mental health, is around trusting. Who can I trust to have access to my data? And if my data is in a certain place on a certain infrastructure, is it gonna be easily hacked, right? People getting in who shouldn't get in and getting access to my healthcare data. The blockchain trust framework really promotes that trust and the privacy and security because it is so tamper resistant or tamper proof. Okay. And again, you know, I go back to why am I even sharing this? And again, I like I said, I wanted to take you out of the textbook and just think, right? Why are you spending the hours and hours and hours that you do in a classroom environment? What's the why of what you're learning? And how can you think future? When you leave and graduate, what's waiting for me outside that maybe a textbook doesn't speak to? So let's talk about the transformation that's happening in our industry. So a little bit of history around the Industrial Revolution, right? We went from the first Industrial Revolution in the 1780s, okay, to now we're in the fourth Industrial Revolution, which is the digitalization of records and the digitalization of healthcare records in this example for our purposes. And so in the Industry 4.0, where we currently are now and actually transitioning into the industry 5.0, we are seeing more connected devices. And we'll talk a little bit more about that when we talk about just even telehealth and patient monitoring, right? I'm trying to link it all together so it all makes sense again as to the why. So right now we're digitizing our records, okay? We have to have healthcare systems talk to each other on a standard so that they're interoperable. We have to also be able to manage the huge amount of data that we're collecting, okay? Be able to analyze that data, visualize that data, so it makes sense, as I talked about when we first started, purpose, vision, so that the information that we get because of the connectivity of the technology can help us to make quality patient decisions, clinical decisions for patients. Why? So that they can have better care, more quality care at a lower cost with a better experience both for the patient and the provider. The 4 aspects of the quadruple aim, okay? To be able to analyze that data, talk about big data, AI, artificial intelligence, machine learning, automated processes are necessary. Artificial intelligence, machine learning, all of that has a dependency on blockchain, okay? Industry 5.0, we're transitioning in that right now, is about the personalization of technology and output, putting the person back in the manufacturing, working alongside machine and man, okay? So then how do you personalize healthcare? Could it possibly be that you look at the DNA, the genomics of a person to be able to determine what medication best suits them, what food best suits them? Okay, yes.
Yep.
Roll it back. All depends on the healthcare infrastructure that you have, being able to have that HII, that whole technology network speak to each other, the interoperability, okay? Having technology that it can run on where you can have more nimbleness to be able to collect data, analyze that data. One area that you might want to read about is like pharmacogenetics, where they're taking the DNA and trying to identify which medications work best using AI. Do you see how it's all clicking together? What are your thoughts?
Oh yeah, I agree with the fact that being able to be connecting all those I guess what do you call it? Medicine and technology. It's just like you said, pharmacogenomics. What was that? Yeah.
Genomics.
Yep. So being able to like personalize a medicine for each person, and not to have to battle like heavy side effects like the ones that are like generically for like everyone. I think being able to do that would be a great, like, a revolution, I guess.
Absolutely. Absolutely. This is a fun time we're living in, you know? I always think to myself, Lord, you could have made me, be born in the 18th century, but I don't know. I'm in, even as crazy as this world is, I think it's a fun time to be alive, to see all of this happening and to be a part of it.
Of course,
Awesome.
the world is really moving very fast right now.
Yes, it is. It is. All right. Good one. Thank you. Okay, let me on my mouse, okay. So again, I go back to, and you know, I sort of talk to this again, another illustration of the fourth industrial revolution, with kind of where we are. And you see one area that I called out is IoT, right? We'll talk about that in a little bit. I think when I talk about telehealth, okay? But I want you to see how it's all fitting together, right? It's all fitting together. The big data analytics, okay. And again, the fifth, the human touch, return of the human touch, the personalization, leveraging, you know, the technology, the Internet of Things, and the Internet of Things from a medical standpoint. We'll touch a little bit about that. And then AI, all about that providing care to the population, that patient-centric approach, quality care for the population. So again, I included this diagram. I think it does a good job of doing a comparison of that transformation between IO 4.0 and 5.0. You know, what the focus was or is currently, because we're still in the Industrial Revolution 4.0, right? Focusing on machines, the digitalization, the connection, to what we're going to be focusing on now, delivering that customer experience. And if I change that word from customer to patient, you'll see, or even provider, you'll see where that quadruple aim fits in, right? Focusing on delivering that patient and provider experience, the hyper customization, okay? That distributed supply chain, which again, the blockchain technology can help to manage that. You talk about 5G, you know, you ever thought about 5G? And I don't know too much about 5G. I haven't really studied it much, but if you talk about healthcare infrastructure, where could that fit in the bigger picture? Okay, I'm curious, knowing what you know now about our current healthcare IT infrastructure, okay, what do you think is going to be the biggest challenge in getting to what I'm talking about here in terms of the technology and the care delivery model? What do you think the biggest challenge is?
Maybe making it accessible to everybody in the country.
I lost you for a minute there. The first person was speaking. I don't know who that was.
Oh, I said making it accessible to everybody in the country.
You come up on a good point, and I think I addressed that in one of the other sessions, but very good. Go ahead.
I think just to piggyback off of that one is just consumer adoption of technology, of like wearables, or having that information transmitted to some repository for that information.
Good point. Good point. Very good. What about if you are a hospital in Brooklyn? What do you think the biggest challenge is there?
Finance.
Excellent. Yes. Who's going to pay for it? Right? Just the infrastructure. When we think about legacy systems that are currently in-house, you know, when we do, let's say, for example, an Epic EHR implementation, we usually go through in the pre-work phase, like a rationalization of applications, right? Meaning that they may have a list of, I don't know, 500 applications, both clinical and business apps, that you have to go to and figure out what Epic is going to replace, okay? And some of those systems are old, right? So you really gotta rip and replace them. Sometimes you go through in the network, the Wi-Fi, all of that doesn't work. So absolutely the cost, that total cost of ownership, what is it gonna cost you to rip and replace to achieve that next level of care delivery. It's a huge problem, but I think huge opportunity also. So this slide basically just kind of talk about that hyper-personalization and the experience, the CX, here's customer experience, but if I were to put a P in front of it, make it patient or provider experience, kind of same thing, right? Getting out of our silos, making our technology and our infrastructure, healthcare infrastructure more interoperable, making it more nimble, right? Laying those platforms. And so my call to action, I always like to give a call to action at the end of my presentations, again, because you have to do something with information that was just given to you, right? So my call to action is, number one, gain education about blockchain and other emerging technology and their application in healthcare use cases, right? And then focus on developing strategies and implement emerging technologies to improve care coordination and quality data collection. So at the end of the day, the information that you learn in these classes is really about that last bullet point. Okay. All right. Yep. Okay. So I'm going to wrap up this topic before I transition to the telehealth. Any questions or comments?
I just wanted to say I find it very interesting, the fact that mental health is actually put on the back burner of things, especially at this time where a lot of people are seeking mental health care. And we're going through this pandemic. Mental health is actually, care is actually very important at this time. And then I found it very interesting regarding the slide about Industrial 4.0 and 5.0, and there was one aspect about bringing manpower back to the factory. I don't know if it kind of goes hand in hand, but the fact is that with the producing of products outside of the country, and we had to rely on different countries to obtain like masks and N95s, and you're thinking a country like the US, we're supposed to be like a superpower, but yet we were kind of crippled at the same time. So it brings that focus back that maybe we don't have to produce everything outside of the country, that we to actually start focusing on producing things within the country.
Good point. Yeah, you know, COVID-19 really exposed us, right? What we thought and who we thought we were and are really was exposed, especially in healthcare.
Definitely.
Eye-opening. Awesome. All right. So I think I've got what, another hour? Is that accurate? I think I got another hour. So let me transition here. Give me a second. Oh. Okay. Give me a second here. Let me. So let's talk about telehealth. Okay, so telehealth. Okay, like I said, I went outside the text. You can read the text anytime. Let's have some fun. All right, so my learning objectives for you, let's understand telehealth. And again, I bring back to the social considerations, right? Telehealth and the social considerations. And someone made a point earlier in the other presentation around access and that equity, right? And I think we have to always consider that. And again, COVID-19 really exposed that too, right? So as a perfect example, children or people who need to work from home or do school from home may have some equity issues, right? Because again, they don't have the technology to support the work that's necessary, okay? And again, I go back to the quadruple aim and understanding telehealth and the quadruple aim. So there are a couple of videos that I have. Let me see. Let me make sure I can do this right. Give me a second here. Let me see the first video. Let me see, copy, open hyperlink. Oh, good, okay. Are you still, you're seeing my screen, right?
Yes.
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 YouTube, okay, coming? Okay, perfect. Come on, come on, come on. Let's hopefully this works. Okay.
The COVID-19 pandemic is altering almost all aspects of American life.
Can you hear?
During this emergency,
Yes.
we've seen a
Yes.
dramatic.
Yes.
Hi, I'm United States Surgeon General Dr. Jerome Adams, and here are 5 things to know about telehealth services. First, telehealth visits are safe. Virtual appointments lower the risk of spreading the virus among both the general population and healthcare teams. Second, telehealth enables those who are vulnerable to the coronavirus, like the elderly and those with compromised immune systems, to continue receiving some medical care safely and without office visits. Third, Medicare allows payments for telehealth services for beneficiaries wherever they are, even in their own homes. Prior to the COVID-19 public health emergency, Medicare telehealth services were only available to people when they were in a rural area and at a healthcare setting like a hospital or physician's office. Fourth, telehealth visits protect patients' privacy and personal health information. HHS has made it easier for providers to offer telehealth services through commonly used technology while still maintaining guardrails to ensure privacy and protection of patients' sensitive health information. And fifth, telehealth is likely here to stay. Of course, there will always be a need for in-person visits, but remote consultations are convenient and are the very definition of patient-centered care. State and federal laws will need to adapt post-COVID to ensure the continued smooth delivery of telehealth for both patients and healthcare providers. To learn more about how telehealth services can facilitate safe and convenient care, clinicians and patients should go to telehealth.hhs.gov.
All right, so that's one I want you to listen to, and then let's listen to the other one, and then we'll talk about that a little bit. Let's see.
Healthcare and technology have been together since the invention of the telephone.
Yes, Mr. Benton? Sally, would you please call Dr. Smith and see if I can get in to see him? Right away, sir.
Once the internet began, and even before, physicians have used video conferencing, image automation software, and integrated medical devices to provide access to healthcare for those living in medically underserved areas. And yet, we found during an informal man-on-the-street survey that few people know what telemedicine is.
Telemedicine? Ooh. Something with online medicine. Maybe doctors are talking to you over the internet. I have no idea.
Medicine that you sell over the telephone? No.
Maybe it means it's medicine that helps people with their addictions to their telephones.
I've never heard of it before in my life. Telemedicine would mean that it's something to explain medical issues in the United States via television or some electronic media.
Something online or through media that helps people with medical needs.
Telemedicine is hopefully something holistic.
Some people had a better idea than others, but no one nailed it. Simply put, telemedicine is medicine delivered from a distance. A resident of an assisted care living facility, for example, who has chronic healthcare problems can be seen by a physician miles away without leaving the facility? Does a worker who becomes ill or injured on an oil platform hundreds of miles from land need to be flown to shore for medical treatment? Using telemedicine, a physician can make that decision remotely. And a child who becomes sick at school interrupts the normal routine for working parents, presents the challenge of getting in to see a doctor, and may mean more days absent from school, unless the school has a telemedicine program.
That's awesome.
Actually, that seems to go with medicine these days. They have a lot of, you can call in, speak with a nurse, you can call in, and so virtual is even better.
I think that would really help people as opposed to just, going on WebMD and finding all this stuff that freaks them out. They could actually speak with someone.
Telemedicine solutions improve access to healthcare and outcomes because patients are seen sooner rather than later, and it holds down the costs. Telemedicine programs are gathering momentum. If you haven't had any experience with them, it's only a matter of time.
Awesome. Okay, let me go back to the presentation here. All right. So again, what is telemedicine? In the slides, the videos explain that, I hope well. But it's all a part of that digitization of healthcare and that healthcare delivery. And in most cases, the telehealth, the mobile health, really, and the telemedicine, all come back to connecting to electronic medical records, okay? Collection of that data. But again, we go back to it's still data, right? So how do you capture that information? How do you document it? How do you aggregate it? How do you assess and analyze it, okay? So in your text, I believe it gives a little bit of historical context, and the videos also talked about that. So you can read the slide. I'm not going to go into that. And what telemedicine is, obviously, the use of a two-way interactive audio-video communication, okay, to exchange healthcare consulting and healthcare data, okay? And the clinical domain where telehealth or telemedicine is used, for example, in radiology, psychiatry, okay? In the ED sometimes, okay, consultation. And that term telepresence was also defined, I think, in your book, being there, that feeling of being there. So there are two types of telehealth. There's the synchronous, meaning the real time, and then the asynchronous is another telehealth type of a presence, okay? So the real time, the synchronous, like we're doing right now, this is a form of telehealth education, right? If you want to think about it like that.
Yeah.
And then, go ahead.
I'm just agreeing with you, sorry.
No, you're fine. So I don't feel so alone out here.
Right.
And then, of course, the second aspect of it is the asynchronous. It says store and forward. I do the recording just like Dr. Jumbo is doing right here. It'll be set in the library, then someone else will go pick it up and listen to it later. Perfect example. So the discussion, the technology and the social considerations, right? So I don't remember who it is mentioned in our earlier topic around some of that social impact in terms of availability, right? Of having the technology. There's going to be a challenge there, okay? There's going to be a challenge there. And we need to think about that. And again, COVID-19 demonstrated that those social determinants of health that are currently present right now is just exacerbated when we come into crisis or need to really leverage virtualization. You'd think it'd be easier, but it's not. People don't have the machinery, they don't have the bandwidth. You know, there are a lot of other things that we have to take into consideration of having parity and equity for the healthcare delivery with telemedicine. Okay, and I have another slide here. Let me bring that one up too. Another video, I should say. Sorry about that. Let's see what this one was about. Is this helpful?
Yeah, the videos are definitely helpful.
Yeah.
B&H is here, from our house to yours, as your collaborators, creative partners, and problem solvers.
You do. It's actually a very good choice.
Okay, let's get to the real thing. Come on.
If you're worried you've contracted COVID-19, that's the disease caused by the novel coronavirus, don't just rush off and see your doctor, at least not right away. It seems counterintuitive, but health departments across the country are urging people with symptoms to call their doctors instead of heading to an emergency room or urgent care facility. This lets doctors better determine if someone is sick with coronavirus and whether they need testing. In addition, the Centers for Disease Control and the World Health Organization are both encouraging people to use telemedicine options like American Well, Buoy, or Doctor on Demand. Many hospitals offer virtual clinics as well. The benefit of calling ahead or going online is twofold. One, it keeps anyone who is sick from spreading their illness, be it the flu, a cold, or coronavirus. And two, it can give physicians and nurses more time to devote to those with more severe symptoms. A new form of telemedicine is being quickly developed and tested in Silicon Valley. Verily is debuting a coronavirus risk screening and testing website. Think of this as digital telemedicine. The online tool will triage people and direct those who are eligible to mobile testing sites. The website leverages Verily's existing health data platforms and was developed in partnership with the state of California. For now, the reach of the project is limited, but Verily intends to eventually scale the capacity as more testing kits and sites become available. Every evaluation for coronavirus starts with basic health questions and a description of symptoms. Next, the patient is asked for biometric data like heart rate and temperature. If one has a fever and an elevated heart rate, that might signal the possibility of developing respiratory distress. For patients with low acuity symptoms, physicians recommend simply monitoring and treating the symptoms. All of the assessment options will help to track those suspected of having coronavirus, so agencies like state health departments and the CDC can monitor the outbreak. Many cases of coronavirus are actually mild or even asymptomatic, making this an unfortunate double-edged sword. An infected person who shows no symptoms and thinks they probably don't need to be tested could venture out in public and infect others. That makes the need for social distancing that much more important. And because the virus can circulate undetected, researchers expect that a large number of people have the virus but haven't been tested. Still, not everyone needs to get tested. So currently, testing for the new coronavirus is not provided on request by members of the public. With shortages of test kits expected, only those who meet certain criteria can be tested. While the promise of telemedicine is that it will keep more sick people at home and hopefully keep a lot of people from panicking, there are some issues. Unfortunately, this approach shuts out anyone who doesn't have the tech savvy or gear to do a virtual chat with a doctor. The coronavirus may spur more Americans toward telemedicine, but since it could still leave some of the most vulnerable behind, it's critical that those who can use it do so in order to leave hospitals, clinics, and specialized testing centers free to attend those who need it most.
Interesting, huh?
Yep.
Very.
Some folks are getting left behind. And you'd think that technology should make things more inclusive, but it doesn't. Anyway. All right, so again, how has COVID-19 changed the use of telehealth? okay, relax certain barriers such as the restrictions on the clinician's location. So prior to this, let's say, for example, I'm in Brooklyn, in New York, and I can only practice in New York. I can practice in let's say, Vermont. So now, you know, more like a provider in Brooklyn and in New York can provide care via telemedicine, telehealth, to someone in Vermont, as an example. I don't know if that's true, but just as an example, right? So the licensing restrictions were relaxed, you know, reimbursement policies through the payers were relaxed, okay? The disparities in equity need to be considered: access, quality, and the patient experience, okay? Going back to those aspects of the quadruple aim. And I have a question, and you know, I put a couple of points here. What must policymakers take into considerations, right? Their racial and ethnic disparities. And then the telehealth need to ensure the expansion of advanced health equity connecting minority patients to care, okay? So when you talk about the inequities or the disparities or you know, some of those social determinants or, you know, just the accessibility, you have to think about our elderly, right? How do you ensure that they can be beneficiaries of telehealth, right? So there are some usability aspect of it that we have to think about, okay? They meaning the geriatric older population, may have a discomfort with technology, right? And that becomes a barrier. And it's interesting, it says it's increased if the patient is older and a minority. So if you think about just the whole demographics of New York, right? And they're stratified, right? So with cultures within cultures, population within population, one solution may not fit for everybody within that culture, within that population. So therefore, then you have patients, like for example, you know, African-Americans who may be more predisposed to diabetes, other comorbidities, and they have mental health issues, as an example, and they don't have access to the proper telehealth solution. How do you effectively provide care for them? Okay. And it's interesting, I found this in some documentation I was looking at. Recent study estimated that 38% of older adults were not prepared to participate at the start of the pandemic. 38%, that's huge. And if you think about it, they were the most susceptible. Yep, most vulnerable, exactly. Thank you for the term, I was looking for it. Okay, so that digital divide, okay, we now have a digital divide. How do you fix that gap? Okay, 63% of rural households reported home broadband access issues, right? Rural as compared to your urban or suburban, limited access. So again, in the framework of the quadruple help, and the stick telehealth there, what do you need to do to better enable that quality and cost and experience? So let me see what time I have here. Okay, I'm gonna allocate 9 minutes for us for this section before we go on to patient monitoring systems. But just quickly, if you were a CIO, Chief Information Officer, a CTO, Chief Technology Officer, or a CEO, Chief Executive Officer of a healthcare organization, how would you address rolling out telehealth to your patient population? If you were in an urban, suburban, or rural. So pick one and give me your thoughts. Urban, suburban, or rural?
Rural.
Okay.
So with rural, I guess a couple of points to keep in mind is the access to medicine in general. So in rural areas, you know, if someone, for instance, someone lives in like North Dakota, it's difficult to get to like your, you know, your primary doctor if you're experiencing a fever. So, you know, they may have to travel like 30, 40 minutes away or even to a hospital. I guess one example, even, you know, out, if you think of Long Island, and if you're familiar with it, you know, out all the way out east near Montauk, how does one person get to a hospital from all the way out there? You know, it's very limited. So to keep in mind, I think the telehealth would be good in a very like rural area where they don't have access to you know, immediate medicine, because someone would be able to get to you faster. But then something else to keep in mind is the technology itself. Like, how reliable is the technology? Because in a rural area, you know, is there like 5G network out there? Is there 4G? And you know, if you're on a poor network, then you, like a 3G network streaming video, it's gonna interrupt. You know, there's gonna be some lag time. So that's something else to keep in mind as someone that's trying to implement this.
Excellent, excellent. Anyone else?
To add on to Edward's response, I guess one way to, like, we could combat like networking or internet issues is to use like new developing technologies. Like from SpaceX, they have the Starlink, so it's like satellite internet. That's one way you could combat the networking issues in like rural areas.
Yeah, and one of the ways to combat that, because again, it goes back, you know, to the point is how do you afford that, right? So even in thinking about that as a CIO, C-suite executive in a healthcare organization, where is it that you can have some public-private partnerships, right? So you'd have to figure out where can the state or the county or the city possibly help with rolling that out. Okay, rolling out the technology. Are there grants that you can get? You know, if you go to grants.gov as an example, most recently I was looking at a grant for rural healthcare to better elevate rural healthcare, right? So as an organization executive, you're looking at not just the technology, but you're looking operationally, right? Which includes the feasibility and cost of doing that, and where your partnerships need to come from too, okay, and the funding. Good.
Professor, another way, I'm guessing for the urban space is maybe having community events, health events, to educate and empower the patients to understand a little bit more about technology and how to use it. And like you said, partnering with, you know, in Brooklyn, I work in a hospital in Brooklyn, and maybe pairing with community vendors, like local restaurants, things like that. You have to understand what's going to draw the patients out to these events to help them understand what you're trying to do.
Yes, that's excellent. In terms of the education, a lot of times we don't think about that, right? So it's that being able to drive adoption, okay? And that's an aspect of it to think about, because we can roll out the best technology available to man, Star Trek version 5.0, but if nobody uses it and it's not adopted, it was a waste. So that education aspect of it is very important. Very good. Let me see what else. Oh, that was the last of that. Let me see. All right. 4 more minutes. So let me transition, use this 4 minutes. Maybe you can grab a drink of water or something. And we go into the last, which will be patient monitoring systems. Okay, let me find that real quick. Okay. I don't think I have any videos on this one, but let me pull this up. All right, patient monitoring system. So objectives, defining patient monitoring, and then I threw in a couple of concepts in terms of the inpatient versus remote or outpatient patient monitoring. And then understanding remote patient monitoring market trends. And I bring this in and share this because, again, you know, as technologists or as healthcare, we still have to think about, you know, the business of providing healthcare, right? And where some opportunities. So what is patient monitoring? So it's monitoring, it's continuous monitoring of physiological parameters such as the heart rate, heart rhythm, blood gases, blood pressures, respiratory rates, okay? In your text, there was a case report, a case example of this 27-year-old man injured in an automobile accident. But the whole thing I want you to take away from this is that this is an example of an inpatient setup in the intensive care unit in a hospital, ICU. If you take a look at the picture, you'll see you've got the bedside monitor, you got a ventilator, you got IV pumps, you got wires and everything going on, right? Within that space and attached to that patient and sending data from, for example, those monitors on the patient through to the electronic healthcare record system, right? Where it's being stored, okay? And here's an example again, I think this is from your text also, this HELP system. I'm not familiar with this HELP system, but I guess Intermountain Health has a system called HELP system. But what it does demonstrate, as I just mentioned, is all of the data, right? Coming from all these different sources, okay? Coming in and being stored into the electronic healthcare record system. And we talked about the ventilator, we talked about the pumps, the scanners, you know, all of that. It's just data, okay? And in the ICU and the inpatient world, you know, most likely, like I said, ICU is a perfect example, right? It gives examples here of types of patients, category of patients who need this continuous monitoring, right? So number one, patients with compromised physiological regulatory systems, okay? Patients who are currently stable, but with a condition that could suddenly change because of, you know, life-threatening situations. That's why they're in the ICU in the first place, okay? And then patients who have, you know, trauma, right? Or septic shock is a great example here, right? We have to monitor, continually monitoring what's happening to them internally. So the whole idea, again, I go back to why do you even have this healthcare infrastructure? Why do you have the telehealth and telemedicine care delivery? The whole idea is to access data and acquire data so that you can analyze that data for the intent of making quality, pertinent, timely, accurate decisions, right? Clinical decisions, so you can save someone's life. Okay. So in addition to the ICU scenario and collecting data in an inpatient scenario, there's also the remote patient monitoring, right? And that remote patient monitoring, acronym RPM, is a type of telehealth system. Okay, so the remote patient monitoring is a method of healthcare delivery that uses the latest advances in information technology to gather patient data outside of the traditional healthcare system. So examples, glucose meters for patients with diabetes, right? So I'm a diagnosed diabetic. I wear the Freestyle Libre system. And on my phone, I'll show you on my phone, it's my phone, I have an app where I scan. I don't know if you can see that. I'll scan. Let me see what my glucose is now. 132. I wish it was lower.
Wow.
So again, right? Data, right, being stored on my phone, okay? Heart rate, blood pressure, many things, okay? Again, just patient monitoring. And this is one example of a perfect example of putting the data in the patient's hands, right? So that I can make a decision. I can monitor, remote monitor my glucose. I don't have to go into the doctors to get my fingers stuck. I don't really have to stick my fingers, thank the Lord. but I can manage and trend, right? I can trend to see where my glucose is, right? And help to manage that. right? Putting the onus of my health and my wellness in my own hands. So there's some benefits here, okay, of the remote patient monitoring. I'm just demonstrating that, okay. Reduce costs of a care provider and patient alike. So if I were to go in every day to go see my primary care for them to tell me what my glucose is, oh my goodness, I can't imagine what the cost of that would be, right? Not feasible, not feasible. And then enhance patient engagement, which again, demonstrated here. I am engaged in my own health and wellness. So I go back even to the sustainability goals for that health and wellness in a country that may be a developing nation, but they have a cell phone. And if they're a population who are predisposed to diabetes, as an example, or maybe that's just America because of our diet, but still, if I'm able to put a monitoring system easily in their hands, they can better monitor that in their health. They can transfer that information, that data, or share that information with the World Health Organization, so that then when they aggregate their data to do their report, like say annual report, which they can report out, you know, Senegal diabetes decline with, you know, X%, right? Then again, that can line up and be aligned with their roadmap that they set out between 2020 and 2030. One of our goals is to improve the diabetes or obesity, reduce obesity in Senegal, just making it up, right? But then that way, at least they have the data. Right now, there are gaps in data. They don't have it to even easily track and measure the sustainability goals and the targets that they set out globally. I do have a video. Okay, so here's one. How much time do I have left? Oh, we got time. Okay, good. All right, let's take a look at this video.
The rise of the Internet of Things has potentially life-saving applications within the healthcare industry. By collecting data from bedside devices, viewing patient information, and diagnosing in real time, the entire system of patient care could be improved. Not to mention the patient experience. By 2019, 87% of all healthcare organizations will have implemented IoT technology. But today, many healthcare devices operate in silos. Over a third of healthcare organizations don't apply data from connected devices to other business processes. An issue that creates inefficiency, potential for data loss, and mistakes in diagnosis. Effective healthcare depends on speed and accuracy, and we have seen a huge range of devices becoming connected as IoT takes hold. Over 50% of devices on healthcare networks in the next 2 years will be IoT devices. Like those you see here, from handheld devices to health records to medical equipment, the industry is embracing the world of connected things. With a common language and a single platform for these devices to operate, the potential for IoT is limitless. For caregivers, the ability to easily monitor and manage patient health can save precious minutes every day. Without having to manually visit each patient, the expert can give a remote diagnosis and track medical assets, providing quality care more quickly and managing the healthcare environment more efficiently. Using sensors and Wi-Fi, the ability to locate the right department in a hospital while retrieving essential information becomes straightforward for both caregivers and patients. Nearly 3/4 of healthcare leaders who have adopted IoT believe its key benefit will be to monitor and control medical devices and sensors. From patient heart monitors to temperature gauges, this real-time data already exists in healthcare. And now it can be used to create a safer and more effective environment. Through a single application on a mobile device, patients and staff can securely manage IoT data. IoT means an easier and more efficient patient care experience, allowing staff to do their jobs better. Which is why 76% of healthcare leaders predict it's going to transform their industry.
Oops. Okay. I love that video, actually. So, sure. Okay. All right. So again, you know, the remote patient monitoring and the Internet of Things, IoT. You remember back when we talked about the health information infrastructure, and I showed you the picture of the fourth industrial revolution, that one slide with the circle and, you know, the different arrows pointing. IoT was one of the ones I pointed to, remember. So here we are, tying things together, okay? All right, this is it, right? The IoT platform. You see where we are on the timelines. You see where we are within the framework of the technology and how it applies to care delivery and the patient, okay? So we do have the intersection of blockchain, which we talked about, Internet of Things with the remote patient monitoring as an example, data, AI, and care delivery, okay? And I love William Deming, if you know who he is, but you can look him up. In God we trust, all others must bring data. Love it, okay? So part of what we do, again, with the healthcare infrastructure, having the right technology in place, talking to each other, gathering data, storing it safely, okay? Extracting the clinical data, that data to get insight and bringing it from disparate systems and disparate data, okay? And doing the analytics on it. And then be able to transform that data, use that data, that information, that intelligence, right? That wisdom. I think I saw Dr. Jumbo when I joined you last time, talking about the wisdom and information intelligence in data, again, for patient care, right? Turning that data into value for patient care. That's what it's all about. So in the next few minutes, I want to talk about market trends. Why? It's good to know, right? It's good to know what's happening in the market. So what's the market value for remote patient monitoring systems? Okay. Remote patient monitoring systems, market value in the US, okay? US dollars. What is that number? 1093.47, okay, million. It's going to reach 3229.13 million by 2025, okay? And with a 73% compound annual growth rate. What does that tell you?
Big business.
Say that again?
That is going to be a big business.
Big business, exactly. Exactly. It's like nearly a 3-point explosion between 2018 to 2025, right? So when I think about this, I think about opportunity. When do you all graduate?
2022, 2023.
Okay. 22, 2023. So even now, while you're in school, think about this. Where can you find opportunity? Maybe you know, if you don't already have a business, maybe you can start a business, or in terms of education, technology around, you know, IoT, all of the technology that's going to support and be needed for this market growth. Okay. Another data point here, by 2027, 2.14 billion. Big opportunity. Okay. Another data point that I got here, and I couldn't get to the full data, but I just snagged this. I think we can interpret it based on the size and the color, what that market trend and the market sector is, especially for the disease state. So, for example, 14.9% is a cardiovascular diseases. That's that light blue area here. Big opportunity there. And I think when we go back a couple of slides, it says increasing incidences of cardiovascular diseases, lifestyle-related disorders, and demand for independent and healthy living are some of the major factors driving the growth, right? So if we go back here, based on this analysis, 14.9%. But if I look at the yellow, this gold, diabetes, huge. And again, contributing probably because of our obesity, and in some cases, like my case, is genetics, you know. But again, from a remote monitoring opportunity, if you are so inclined to maybe break out and maybe create applications monitoring distributed apps, maybe to monitor diabetes, maybe an area of focus, you know, the cardiovascular. The next larger area, this orange area, cancer, right? Cancer. What type of monitoring, remote monitoring, would be helpful for cancer patients? You know, my mom was a cancer patient, and there are a lot of things that they suffer from, you know, both mental and physical, pharmacology types things too. So by product, areas that you could maybe, you know, research more on and see what draws you: vital signs, blood pressure, pulse ox as an example, special monitors, you know, cardiac, respiratory, fetal heart monitors, prothrombin, that's for blood clotting, okay? By application, like I talked about, whether it be cancer, viruses, okay. I'm wondering, again, considering what we know about the SARS virus, the coronavirus, could you develop some monitoring system that could monitor viruses? I don't know, you know, but potential there. And then the users of it would be hospitals, the ambulatory, like the clinics, or even in home care, okay? Home care, another potential growth area. And so I kind of outlined for you, you know, based on this analysis that I got information from, sort of what the revenue potential is per area. And this is between 2016 and 2026 timeframe. So, you know, even as I think about it, as you're going through your classes, because I like to make things make sense to me, it has to be practical, right? I remember sitting through calculus and thinking, or differential equations and thinking, how am I going to use the integral of whatever in my daily life? I don't know. You know, but I had to sit through it, but I didn't have any forethought as to how it applies or could apply, right? So I'm sharing this with you, that as you go through your other classes, you think about, is there an area of interest for me here? And if so, what can I pull from that class to mesh with this information to maybe come out with the next Facebook of the new generation, right? Who knows? Or the next Amazon. Okay, and let's see, I've got Okay, for them. So discussion, I think, let me see. I have 2 discussions and then I'm done. So the first discussion, why remote patient monitor is critical after COVID-19. And I've given you some pointers here that you can kind of think about, right? Before the epidemic was primarily used to monitor chronic conditions, right? Just like I showed you with my diabetes monitor, okay? It says moving forward, it will be even more important to keep these patients, right? These COVID-19 patients out of the hospital, right? So they don't these risk patients, the high risk patients, so they don't contract the disease. I can tell you people get sick more by going to the hospital than not, because everything just, all the diseases are there, right? The exposure is higher, okay? So what are your thoughts in terms of why remote patient monitoring is going to increase, especially after COVID-19? COVID-19 is like a black swan event. It's actually a black swan event that's changed our world. Talk to me, tell me, what do you think?
Just to maybe decrease spread, especially in New York City, having people travel to the doctor, sometimes use the subway system, metro system. You can have that easily bypassed if it's remote.
Mm-hmm. Mm-hmm.
In terms of like COVID-19, since it's so new, people are still unsure what are the long-term effects of like COVID-19 even after people recover from it. So remote patient monitoring would be useful to study and analyze how it affects people after they recover from it.
Mm-hmm. Excellent. And you brought up a good point that I hadn't touched on, but the role of even research, right, in this whole thing, because even getting all of that data and having researchers have access to it, the more information that verifiable information, and that's again where blockchain comes in terms of a research component of it, is that if that data is verifiable, collected remotely, and then the researchers can get access to it, just think about the potential of what could be learned from doing that. Anyone else?
I think also more people would want to be more well prepared if another pandemic were to arise. Just a quick comment. We saw that when it came to pulse oximeters and thermometers, people were buying them out, and blood pressure monitors, people were buying them out, and you couldn't read them online. So it's just being able to have that access, to have that supplies just in case something were to arise in the future.
Excellent. Yep. All right. And then last but not least, it said, will RPM widen the digital divide, right? So this is just if you get access to the deck, which I think you do, I've actually, let me see if I can bring this up here so I can see it better. And it's from the advisory board. So in terms of, it tells you what RPM is, right? We talked about that, okay? And the increase in RPM is being driven by many advances in mobility and sensor technology, okay? So even before implementing, and so this is part, we talk about the infrastructure, right? And implementation of technology. And even back to my question around, if you were a CTO, CIO, CEO to roll out telemedicine and telehealth and remote monitoring, what are some of the things you need to consider, right? And so good points here that you need, and questions you have to ask yourself, is it feasible, right? Is it clinically relevant, and is it cost effective? Okay, so there's some technical considerations that you'd have to bring together your senior level staff to do an analysis, and kind of determine, from your IT standpoint, what's feasible for that architecture, okay? The clinical consideration, where are you gonna deploy it, right? What needs to be considered from a clinical utilization standpoint? And then can you afford it, right? What's the total cost of ownership? What's your return on investment, okay? So if technically it's not feasible, right? It's not going to work, obviously. If it's not clinically relevant, the clinicians are not going to use it. And if it's not cost effective, then you can't afford to deploy it. Okay, so just some thinking again when you look at overall, you know, health information infrastructure, right? The interoperability, the telehealth, the remote patient monitoring, all of those things requires and would need a decision, analysis decision. And then going back to the social impact, right? Back to the access of certain people in the population, right? The question is, will the remote patient monitor widen the digital divide? And I've got 5 minutes before I turn it over. What do you think? Someone talk to me. Don't get quiet on me last minute.
Come on, guys. I know a lot of people that have not said anything yet. Should I start calling names?
No. Well, I think personally it might widen the digital divide because of social economical status. A lot of populations don't have access to all these RPM. So yes, it would widen the digital divide.
Yeah. Yes. All right. Thank you so much. This was fun. I mean, I enjoyed putting this together, and I enjoyed my time with you. I think I see you in a couple of weeks, or yeah, on the week of the 4th, and we'll talk about natural language processing, management of information in healthcare organizations, and information retrieval and digital libraries. So I've got my work cut out for me.
Thank you, Dr. Ingram.
Thank you so much. That was wonderful.
Thank you so much.
Great presentation. Thank you.